Hi, my name is Dr. Peter Lynn. I'm a wellness chiropractor specializing in chronic, metabolic, and neurological health conditions. Most doctors treat a symptom or an organ, not the whole person. Our patients are treated metabolically, neurologically, and structurally. Why? Well, all chronic conditions have several things in common. And today I want to talk to you about blood sugar imbalances, insulin resistance, and diabetes. All of these chronic conditions have several things in common, such as oxygen deprivation, imbalances in blood sugar, which diabetes is, dysregulation of cortisol and other hormones, imbalances in the digestive system, anemia, autoimmune attacks, and brain imbalances. If you understand how your body functions, you can appreciate how it can break down, and then you know how it can be fixed. Treating the symptoms of blood dysregulation is like pumping medications into the body, and it's like putting air in a flat tire and never finding out what made it go flat in the first place, but keep pumping it up over and over again. Let's talk about a few very important organs and glands in the body. Your hypothalamus is an endocrine, it's in the brain, and it's an endocrine and nervous system. It participates in those actions. It controls the pituitary gland, which is a hormone. It's a master regulator gland. It produces hormones that run the thyroid gland and adrenals and other organs. It secretes chemicals into the nerve system. The thyroid gland releases hormones that control the entire body's metabolism and the rate of food that is produced to produce energy. The adrenal glands you've heard about, these are your stress glands. They produce adrenaline and help you deal with stress issues in your life. Metabolism and immune parts of the functioning. The pineal gland is also another organ that produces melatonin to help you sleep at night. And the pancreas, in your case, is also very important. It produces glucagon and insulin, the hormones real important for blood sugar regulation. How do you know how these organs and glands are working? Because they work synergistically. They work together. Well, you've got to test them. And the testing I'm talking about is unlike you've ever had before. There are two ways to looking at blood tests. One is you're very familiar with is the pathological ranges. So for example, if we look at blood glucose or blood sugar, a fasting rate in pathological terms might be 64.8 way up to 104.4. When these are outside, when your markers are outside these ranges, then you have functional or pathological problems. But what I'm looking at is functional ranges of blood sugar. It should be between 85 and 99 to be optimal. When you push outside of those ranges, then you begin to have tissue destruction and you develop pathology at a faster rate. So why not keep them in a functional range? And that's how your body works. All the markers are important to function in a functional range. We're looking for breakdowns and malfunctions in multiple systems of your body to finding out what the underlying causes of your problems are before it turns pathology. We want to test your thyroid panel. That has an effect on your sugar. Not just TSH, but T4 and T3. We want to do a complete metabolic panel, a complete lipid panel, because that's directly affected by your sugar levels. A vitamin D composite. A CBC, a complete blood chemistry with auto differential. We want to see what your white blood cells are doing if they're fighting infection. A sensitivity test, which is a DNA analysis of antigens that almost every person with a chronic condition has positive. A number of years ago, I wrote a book called Barren Harvest, and it's a novel about genetically modified foods. And boy, I'll tell you, we've never seen genetically modified foods in the history of the world, and our bodies are trying to deal with them, and I believe we're going to have some real problems in the next several years because of these foreign antigens that our bodies are reacting to. Very destructive, and I'm beginning to see some of these changes today. We want to test your adrenal stress levels and find out what your cortisol is doing. We want to challenge your autoimmune system or immune system to find out if you have autoimmunity developing. An intestinal permeability test to see if you're absorbing the foods that you're eating. If you're not, that's a problem. We want to check your neurotransmitter profiles to see if you are producing hormones correctly and what you need. Oftentimes depression, fatigue, mental fogginess, mood swings, hot flashes, and sweating, weight gain are due to neurotransmitter imbalances. So we have a way to look at this. We want to test inflammatory markers like C-reactive protein and homocysteine. These are also affected with blood sugar imbalances. See, we're looking for deal breakers that must be addressed with you before you can get well. And on top of your list is blood sugar. The relationship between hypoglycemia and insulin resistance, prediabetes. There's things that we can do. Right now, there's no medication to affect these, and it's not a medicational deficit, it's a functional problem. We need to find out what it is. Fatty acid, and like cholesterol. We want to find out if you have any anemias or digestive or liver imbalances. And of course, the big one is autoimmune syndromes. To understand what is affecting your health, you must be evaluated completely. We're past the days of, here, try this and see what happens. Today we can find out. So metabolic testing is one half of the equation. Well, the other half is evaluating you functionally with your nerve system. Your brain and nerve system need two things to survive: glucose and oxygen. And we just covered glucose, so oxygen is also very important. If these are faulty, your brain is faulty and the rest of your body suffers. So we're going to evaluate you neurologically. And some of these tests may include tissue oxygen saturation, heart rate and rhythm, reflexes, eye patterning tests, cranial nerve tests, cerebellar tests. See, the spinal cord carries energy from the brain throughout the spine like a river to all the organs, tissues, and cells of your body. Each cell is completely dependent on that energy to stay alive and healthy. As long as the cerebellum is receiving proper amount of nerve supply, it will supply the rest of the brain. But if the cerebellum is not receiving the proper amount of nerve input, it cannot send the proper amount of nerve input to other parts of the brain. It feeds the brain. Not enough nerve input to the brain means that there is a deficient amount of nerve input to the lower parts of the spinal cord nerve system. So what the brain does is it misfires. Parts of the problem that develop from misfiring are depression, anxiety, loss of memory, loss of sensation, irritability or anger, balance disorders, dizziness, even just expressing what you want to say, difficulty with that. One of the complications of diabetes is peripheral neuropathy, and this is a function of over and over of a deficit of glucose not getting into the cell. It's caused a lot of times by insulin resistance. You get damage from the peripheral nerves from lack of fuel supply. It's not caused by a drug deficiency. Drugs don't fix the problem, they allow the problem to continue. To fix the problem, you have to diagnose it by being thorough in the examination. What parts of the brain needs help? You have to test neurologically. What parts of the metabolic system need help? You have to test them metabolically. You have to check the functional values too, not the pathological ones. And remember the tests I talked to you about. These all have to be checked. If you miss them, you're going to miss a piece of the puzzle. Some of the metabolic protocols may include a customized protocol of vitamins, minerals, supplements, customized nutritional plans such as what to eat, what not to eat, when to eat, how to eat, getting your lifestyle back in shape. Some of the brain-based therapies, all neurologically based and clinically proven, may include like exercise with oxygen, getting exercise perfused into the tissues, microcurrent stimulation, spinal decompression, special and specific brain stimulation to increase function, eye exercises, a myriad of, it just depends on what the problem is. You see, all health problems are a combination of causes. Most health conditions are syndromes involving multiple systems. Correcting the brain misfiring and metabolic dysfunctions help the body to resemble itself back to health again. And retesting lets us know we are on the right track with our treatment programs and allows us to make correctional changes quickly. We treat the whole body by trying to put all the pieces of the puzzle together at the same time. So here's what to do. We begin with a 2-visit program. You call our office and schedule an appointment. You fill out the paperwork while you're waiting to get in and have it on my desk and any recent lab work you may have had before your first visit. Then on that visit with you, I will go over your paperwork and perform a functional neurological exam, and then you'll be dismissed. Then, on the second visit, we'll review the neurological findings and discuss why I am or am not able to accept your case. If your case is accepted, we will discuss what functional testing will be appropriate and needed, and the preliminary neurological treatment that will start, and any finances that we need to discuss. It's important at the second visit that you bring in someone that can understand this with you so it's easier. Now that you know there are answers to your health, ask yourself these important questions. How has your health problem affected your job or your relationships with your family and other people? What does it cost you in time, money, or even happiness to continue with this problem? Where do you picture yourself? I ask this all the time with people. Where do you picture yourself in the next 1 to 3 years if your problem isn't taken care of? And what's it worth to you if we could get some changes with your blood sugar issues and other problems that we find along the way? We've got protocols and systems set up in place to be able to handle this. So I'm Dr. Peter Lind. I hope you enjoyed this quick video, the brief synopsis of the conditions, and I look forward to meeting with you soon. Hi, my name is Dr. Peter Lind. I'm a wellness chiropractor specializing in chronic, metabolic, and neurological health conditions. I've been in practice in Salem, Oregon since 1988. Most doctors treat a symptom or an organ, not the whole person. Our people are treated metabolically and neurologically. Why? Well, most chronic conditions have many things in common, such as oxygen deprivation and types of anemia and imbalances in blood sugar dysregulation, cortisol and other hormone imbalances, digestive disorders, autoimmune attacks, and brain imbalances. So if you understand how your body functions, you can appreciate how it can break down, then you know how it can be fixed. Treating symptoms with medications is like putting air in a flat tire and never finding out